Good morning, everyone. I am Sayada Afshan, the trainer and the director of EMAS Teacher Training Academy. Today, I would like to speak on identifying special learners early. It will be a practical guide for teachers and principals. So, as we all know, right, every child learns differently, but some children learn significantly different. So, today, we will discuss how to identify special learners early before challenges turn into failures or trauma. Many schools unknowingly admit children with learning difficulties as normal students because the disability is not obvious. Early identification prevents emotional damage, school refusal, bullying, and loss of self esteem. As an educator, our responsibility is not to fix the child, but to understand them, support them, connect them to the right professionals. We are coming across day to day the system of inclusive education, right? Because of that, and maybe previously also, many schools they admit the children as normal students, and there comes the difficulty. The visible difficulties are there, some are invisible difficulties, that is learning difficulties. Okay, so we can physically observe them, like example like mobility issues, speech impairment, hearing or vision problems. Invisible difficulties are like they are often misunderstood. It might be you think of laziness or misbehavior. Invisible difficulty is nothing but your mild intellectual disability, emotional disorder, dysgraphia, dyscalculia, dyslexia, autism spectrum disorder, ADHD. These invisible disabilities are very, common in most of the schools if we find it in the students, but they fail to detect these things. When undetected, we label the child as a slow child, stubborn child, not paying attention, always disturbing the class by saying the hyperactivity of the child and all. These actually labels are killing the confidence and also destroying their potential. Okay, so what it matters is we need to identify early. So early detection, early intervention will give you better outcomes. Now, let me tell you one thing. Early identification is what? It is the difference between the confident learner and a uh, traumatized adult, or you can say a classroom success or a lifelong academic struggler. Now, the earlier the diagnosis, the stronger is the long term development. When teachers recognize challenges early, we can plan accommodations exactly, involve specialists, support parents, reduce dropouts, anxieties, and also classroom issues. Now, what are the red flags we can see in the child? Watch the child, just observe the child. Don't make remarks. Okay, you, the teacher, as teacher, you have to observe the patterns over 3 to 4 weeks, not one or two incidents, but academic red flags are also there, behavior red flags you need to notice, socially, all these things you have to notice. If we are talking about academics, if you want to take down notes, you can also take down. If you want to observe the child in academics, you can observe that a child cannot remember a basic instruction. If you ask them to sit properly, take out your book, keep your book here, place your book here, draw the line, or write down from the board, copy this, they will not understand the basic instructions also. Okay, I'm telling you so many instructions, but they will not understand one instruction also. And they reverse the letters B, D, P, Q, like that. Reads, but they cannot comprehend. They write beautifully, but cannot solve a mathematic problem. Bathroom breaks, stationery, all these things they avoid. Excuses. Poor handwriting, we are giving a lot of effort, we are making them write good, but still it's a poor. Now, there are some of the behavioral red flags also. Easily frustrated, emotionally meltdowns, frequent fights, aggression, daydreaming, or staring blankly. They particularly stare on one place only. Okay. Or else they move constantly. They tapping will be done, humming sounds they will create. Okay. And sometimes they also have very strong focus on one particular interest. It might be trains, it might be numbers, it might be a car, it might anything. These are what? These are behavioral red flags. Now, if I talk about social red flags, mm, they avoid group works. Okay. They will not understand sarcasm or tones. They repeat phrases. They will not make any eye contact. Or sometimes they make too much of eye contact. When we see such child, they will be in their own world. So these red flags are not diagnosed. We are not diagnosing the child. We are actually seeing the signals of the child. These are nothing but signals. These signals of academics, behavior, social, which I have discussed, if you notice these things, if you observe them continuously for a 1 month or more than 1 month, then you can come to some conclusion that they might be having some difficulty. So teachers are observers actually. They are not diagnosticians. Okay. So teachers are not at all doctors, they are not psychologists. But teachers are the first line of detection. That's why when they see a child daily in a real environment, okay, they observe more. But a psychologist or a specialist, they only see the child for 20 to 40 minutes. Teacher observes them continuously across weeks, across the subjects, across social interactions, everything. So teacher is the main point here to understand where the child lack. After that, screening tool, checklists, and all these things comes. Okay. So schools should not label the child as autistic, ADHD, or some dyslexia or without evidence and something. You have to say that the child shows indicators of learning difficulty. You can say that they are showing some indicators and recommend them for further assessments. You can ask the parent, you can counsel the parent, you can, they might, it's not easy that they accept also, but still some you have to, console or you have to motivate them. Okay. To send them to the assessment. Okay, now what are the simple screening tools that a teacher can use in a classroom? Okay, to use these things, it's not very important that you should be a clinical expertise or you should be a psychology student. No, any graduate teacher, any diploma holder, B.Ed, M.Ed, if you're not at all, then also if you're a teacher, that's enough. You have to maintain teacher notes, that is observation log for that particular child. Rating scales, learning task, reading, writing samples when you are giving to the particular child, how they are actually doing it. Okay. Then after that, you have to notice attention span tracking also. Then you have to have a parent history form. Checklist you have to have. Now, some tools, you may introduce like ADHD classroom behavior scale you can use, dyslexia screening checklist age appropriate. Okay, you have to use. And sen indicator checklist also you can use. These are all available on easily on internet. Nowadays we have lots of AI apps by which you can always prepare some checklist and all. Now, first important thing is screening should not be shared publicly also, like with the other teachers in staff room, all these things, nor with also with the parents. First, it should go to the SEN department. If in your school there is a SEN department, that is special education needs department, or principal, school counselor, special educator, like that. If you have, then you can discuss all these things with the department. Then they will decide to call to parent and inform them. Okay. Now, when to involve a counselor or special educator? After you observe the things, these patterns, that red flags, the word which I'm using, persist continuously 3 4 weeks or more than that. Regular classroom strategies are failing. Whatever you're doing in your classroom, your teaching method, you're adopting any new method, and it is failing. That particular behavior is impacting their learning or social adjustments. That time you can refer them. That time you should plan to refer. Now, a teacher can go to SEN or a counselor. Then a counselor can talk to a parent. Okay, this has to be informed to principal. Then she will decide which counselor. Then she will decide a parent meeting. Directly don't confront to the parents aggressively. Your child is not normal, compare with the children, saying that they are not behaving properly. This is because they are all that special education child and all. You should not say like that. Never use those words. Instead of that, I would like to discuss how we can support your child better. This is the correct way to tell them. We have noticed some learning challenges in your child. Then you can also say a professional assessment can help us design the right help which required for your student. Okay, these are some sentences or more you can prepare well to, to speak to a parent. Now, classroom strategies before referral. Try some changes first. Seat child near teacher. Teacher can ask the child to sit near her. Break the large task into small steps. Give them some extra time. Provide verbal and written instructions. If you want, you can use some visual clues also. Avoid punishment for challenges they cannot control. Okay. Instead of that, give them these things, these options, extra time, instructions using visuals and all. If performance is improving, it is a learning need. Okay. Not misconduct. So, based on those things, you can gradually make them use and improve them. Now, reality of the schools is why schools fail. The point here is admissions are rushed, teachers are overloaded with the students already, which they have. Principal assume parents will manage, and there is no counselor, no SEN team. Classroom is treated as a military camp, not support space. It's like military camp. They will just tell, good morning, sit down, all of you, sit down. Come on, take out your books. Now I will keep one rhyme, twinkle, twinkle, little star, something like that. It goes on like a military training. So the result is child becomes a problem. Teachers will burn out and parents become defensive. Child will develop anxiety or depressions. Now, what we need to do? I'll tell you, we have already come across NEP 2020, their expectations. Inclusive education is mandatory. NEP clearly states that inclusive education is a right, it's not a privilege. Okay. Schools should have special educators, counselors, IEP, individual education plans. Schools that fail to support special learners, they are violating national guidelines. Okay. They are putting themselves at legal risk. It is a inclusion is not a CSR activity. It is a school competency and moral responsibility. So here the role of the school is also important when you come across such students in your classroom. It's not only the part of a teacher because she is overburdened, she has to see 40 students in the classroom. She cannot give complete support to that particular child. So, a school should have a special educator, counselor, and some individual education plans available so that she can make use of those things and do the thing. Okay, now What is this IEP, individualized education plan? It is a personalized roadmap. Okay. It includes baseline performance, strength and challenges of the child, smart goals, learning accommodations, support services, and also the progress monitoring, how the students improve. For example, instead of writing improve handwriting, you can write child will write 3-line sentences with 70% legibility in 8 weeks using pencil grips and guided worksheets, because the child need a support. So for that you have to have a time. So instead of writing this, you have to prepare one objective and set कि इतने दिन में इतना करना है, इतना परसेंटेज improve होना है. Now, when you're talking to a child, its parent, you have to have an empathy, and you have to have an evidence of what you are speaking, and also a partnership with them to develop on them. So the main thing is never say a child parent that child your child is weak, you failed at parenting, your child has problems. No, you should say we are working together, we want to support your child, something like that you can say. And evidence is show the sample of classwork, observation notes, whatever you have written, specific behavior patterns if you have noticed. If you approach them respectively, parents will receptive. They will listen to you, and they will be more receptive, because when you are approaching them respectfully and clearly with evidences, they will listen to you. Now, here we can tell you, you can talk to a parent like I'm just telling you, like a case study. For example, like one student is there, ADHD. Now you have wrongly labeled them as a naughty child. They are failing in academics. Constant punishments were given to them. Now after assessments also, sitting is changed, short tasks are given, break schedule is being given. Within 3 months, grades improved. Fewer disruptions are there. Now the child is happy. That means if you are giving them a support work, punishment is reduced. That time also, your child can change a lot. If that ADHD child is there, still you are appropriately dealing with the child, then they can become a happy child. So every child deserves a chance to learn in their own way. Early identification will definitely save their future. Lot of parents, if they are 2 3 years, they don't identify. Teachers should identify and tell. They are becoming 18, 13, 15, 17. That age they are crossing, and then they are recognizing that the child has these type of problems. Recently, one of my students, they are of 13 years, 14 years of age. Their parents did not identify, not even teachers told them. So early identification is very important. Teachers and principals are the leaders of inclusion. You don't need to be experts for this, never. You just need to be observer, empathetic and organized. Today, it is not about the disability, it is about unlocking the potential of the child. When we see the child beyond the behavior, we see the future beyond limitations. Okay. So remember this, as a teacher, you have to be, you know, an observer, empathetic, and organizer. So thank you all for attending the session. I hope the session was good, and it is always on the YouTube live. So you can share that link with your teachers also. Do subscribe and like the video. Thank you. If you have any question, you can ask. I will unmute you if you want, or you can type it in the chat box. I will try to answer your question. Any questions?